The purpose of this short slideshow is to introduce the features and benefits of InfuSurf intratracheal suspension. At InfuSurf, we feel it's the little things that matter most. While lower mortality is the most important benefit of surfactant therapy, and all surfactants are equivalent for that specific benefit, surfactants do differ in other responses that make up the clinical course. With InfuSurf, the product's greater potency provides a rapid and sustained acute effect, enabling some patients to receive fewer doses. This high SPB content also makes InfuSurf more resistant to inhibition by the serum proteins, which form the membranes of the hyaline membrane disease. InfuSurf's concentration produces a dosing volume that is large enough to achieve good distribution, small enough to be well tolerated, and in a suspension with a lower viscosity than Survanta or CuroSurf. But what sets InfuSurf apart from all others in the category is that it's the closest to a natural surfactant. It's the only product derived from actual lung surfactant rather than lung tissue. As this chart shows, InfuSurf is the only surfactant solely produced from natural surfactant, with no tissue lipids, resulting in the highest SPB to phospholipids ratio. On the other hand, CuroSurf is a mixture of porcine surfactant and lung tissue lipids, with low disaturated phosphatidylcholines and a low SPB to phospholipid ratio. Similarly, Survanta is a mixture of bovine surfactant, lung tissue lipids, and supplemental synthetic lipids. During processing of the lungs to manufacture Survanta, almost all of the SPB is lost. Consequently, Survanta is an SPC-based surfactant. As seen here, InfuSurf, in comparison to CuroSurf and Survanta, has the highest SPB to phospholipid ratio. And that's why it has superior potency as well as superior durability. Why is the SPB to phospholipid ratio important? SPB is critical for forming the dynamic and stable alveolar surfactant lining film. SPB is essential for moving phospholipids in and out of the film with inhalation and exhalation. Furthermore, SPB is in the film itself, preventing film penetration by inhibiting proteins and lipids. This allows InfuSurf to create immediate improvement in respiratory function. As this graph highlights, InfuSurf has a more vigorous, more rapid, and more sustained acute effect than Survanta or CuroSurf. InfuSurf also maintains its beneficial effects longer than does Survanta. This chart presents results from a blinded study in which InfuSurf effects lasted longer than Survanta, whether given to prevent or treat RDS. For both drugs, retreatment was given if more than 6 hours had elapsed since the previous dose, and the inspired oxygen requirement exceeded 30%. In closing, although all surfactants are equivalent in delivering lower mortality rates, the formulation of InfuSurf delivers an advantage over others in higher SPB content, and that provides a vigorous and prompt acute effect that is well sustained in treating RDS in premature infants. For all of us at InfuSurf, it's the little things that matter most.